If you have been diagnosed with a desmoid tumor, you are likely Googling what to do for a desmoid tumor. And one of your first questions might be about surgical removal. To get right to the point, they do not recommend surgical removal, especially if you have FAP. If you have a desmoid tumor, people have had it removed, but it depends on where it is and what's going on. Surgery can provoke further tumors, and desmoids are known to come back, sometimes uncontrollable. The second option that will probably come up is chemo. When you have a tumor or you have tumors, these desmoid, can be life ending because of how they can wrap themselves when they grow. They can wrap themselves around arteries, they can strangle organs. For those who have in a muscle wall or on a leg or limb, there's pain, there's movement issues, there's psychologically depressingness. And then, of course, you're adding more symptoms when you go on chemo. You're adding a whole nother host of issues. For me, that was a huge concern because my son was 3, almost 4, when I was diagnosed, and I did not want to be some of the symptoms. I was concerned about my work. So chemo has a lot of downsides. Surgery has a lot of complications depending on the area, and also it's just not the most recommended. Those are 2 options. As of the past couple weeks, we have a third option. Thank goodness. I was in a research trial for the past 2 years. I'm still in it, actually, and have had success with the class of drugs that is now accepted by FDA. It was the best answer for me for the very dangerous tumor that was growing. And it had been not growing, and then all of a sudden it started growing after 3 years, and that was the one that was the most scary of all, because when it's near an organ, that's when you're in trouble. If it's in the muscle wall, that's painful. There's now an FDA-approved medication that does effectively treat a desmoid tumor. This one is approved since November 27th, 2023. It is on the market. You can ask your doctor about it. So the drug that I was on is not yet accepted by the FDA, but they're finalizing the study, in the coming year or 2. I don't know. That's out of Sloan Kettering with Dr. Gounder, who is the head of the Desmoid Tumor Research Foundation. It's pretty amazing that he found this class of drugs and developed it and tested it, and I'm a guinea pig. The symptom list for these FDA-approved drugs looks like a symptom list for chemo. It's so daunting and scary, as is everything, but you want success. The one that I've been on, I know it's been tremendously successful. I had a mesentery tumor near my small intestine artery, and I only have a small intestine. I don't have a colon or a rectum because I have FAP, and that will definitely give you colon cancer by age 39. Other people with no FAP get desmoid tumors. It's its own thing. These drugs work effectively. As someone without a colon who's on the research trial, the diarrhea issue can be a problem when you don't have any large intestine. I live with a lot of physical conditions from not having a colon, and it's manageable. So if you have a colon, I would be shocked if you had too many symptoms, if any. I had 4 desmoids diagnosed right at the beginning of COVID, which was wow. Everybody's worried about the world ending, and you're like going through Penn Station on your way to Fox Chase in Philly for a recommendation from a specialist who then gives you the wrong information. I was like traveling through Penn Station as it was a ghost town going through New York because the country was shutting down. And then, of course, there was a lot of anxiety being a mother. I had to do a lot of research. And then I go to Sloan Kettering or Dana-Farber, where there's a Harvard University professor is like, no, we're not going to cut out your desmoid. That's not even a question. If like so that's hard to read about. Some people have had difficulties with surgeries that you can find on the forum. I definitely recommend signing up for that special group. If you don't have a Facebook account, it might be worth it just for that. That's why I'm here, trying to give, share, pass on what what helped me. And I also had cryoablation on 2 of those tumors like a year after COVID at Sloan Kettering, and I highly recommend looking into cryoablation if you have a tumor in the muscle wall. If it's superficial, it can be cryoablated. An oncologist who since went out of practice had told me don't do cryoablation, only because Dana-Farber doesn't do it, but I did it at Sloan Kettering with Dr. Aaron Jerry. It was one of the best things I could have done. There was no real recommended way to treat desmoid tumors. Like the only recommended way was really chemo and surgical removal. But the surgery, yeah, you got to tread lightly there. And definitely think twice if you have FAP, and make sure you're going to like a specialist, because I've gone to specialists that were not specialists. I knew more than they did because I had read the research. And then I go to Sloan Kettering or Dana-Farber, where there's a Harvard University professor is like, no, we're not going to cut out your desmoid. If you are diagnosed with a desmoid tumor and you are scouring the internet, I just kind of wanted to be a normal person who has gone through this the past 3 years with very extreme, like life challenging situations, and found resilience. A lot of that is like inner work. I think that illness and the suffering can make you a stronger person. It kind of opens your perspective to life and suffering and how people live in, challenging situations. And I would like to pass on any of my research or strengths or knowledge, experience, but don't spend too much time on the internet. Just look at me. I look like I'm being honest, right? I'm here.